Hi Dr. Pillion, this is my oral video project. The group I chose for my oral video project is the lesbian culture. What I knew about this culture prior to doing any research is that my big sister is a part of this culture and she is the most funniest woman out there. She's super intelligent and really caring. So within my research for this culture about their norms, beliefs, language, etc., I found on a website this article made in January earlier this year named A Beginner's Guide to Lesbian Culture 101 by Alyssa T. One of the main ideas the author explained was how the understanding of if another person is also the same sexual orientation could be difficult to tell, especially if they do not fit the stereotype of a lesbian. She further explains that for some people who are lesbian, this feeling can feel obvious from a very young age, and for some, they might be late boomers, or for people raised in households where this type of culture was not accepted. It could take them a long time to be open about their culture. The author's point of view within this culture of the romance aspect of lesbians is that they are very affectionate with how they love. They love deeply to their significant other. Even if it was just a one-time thing with the person, lesbians love deeply with another lesbian. So another main idea states that within the most recent decades, there have been an increase in the lesbian culture added into movies and into books. She also mentions that the lesbian language consists of humor. Lastly, a main idea for relevance of my project that I took from her article was within their culture, she has noticed a lot of her first dates with other lesbians ask about her astrology sign, and they tend to look deep into this concept. To get more understanding of the lesbian culture, I also read into another article from a website. This article was made in 2021, named A Brief History Lesson on the LGBTQ Experience by Hilary Henderson, to get just some more insight on the beliefs and community strength within the lesbian culture. To get insight of the stereotypes lesbians face, I read an article from another website. The article was made in 2016 and is named Lesbian Stereotypes, the Worst and Most Hilarious Ideas Many Have About the Community by Mary Malaya. The main ideas within this article that are explained are, as stated literally in the title, negative stereotypes and positive stereotypes that the lesbian culture has faced and is still facing. The last article I read was from another website, and the article was posted in 2024, named Access to Healthcare Among Gay, Lesbian, Bisexual, and Transgender Persons in the United States by Stephen S. Colin and by Plab Data. This article was posted in 2024, in case I didn't already say that. The main ideas focused on this article were the lack of health insurance, avoiding or delaying care because of costs, healthcare discrimination, access to culturally competent healthcare, and lack of preventative care that the LGBTQ community come across. The person I chose that fit in the lesbian culture is my sister-in-law. She is 31 years young, a Middle Eastern female, has her master's in politics, and is an amazing wife to my big sister. In detail as to what we discussed went as follows, with the many pet interruptions during our phone call. She has cats and I have puppers. Lesbian culture means resilience to her. She explained that she is happy to be a part of a group of people that understand what she has been through and understands her as a person overall. She further explains that within this culture, they are the type of people who have always taken care of one another within their group of people. She also mentioned that lesbians are funny people. They tend to use a language of sarcasm a lot because it's funnier to be in that tone of voice versus being in a very serious voice tone. Her strong belief of the lesbian culture is that there are layers to lesbians. Some lesbians believe in astrology to the maximum and follow it religiously, but that's within a specific group of lesbians. She further explains that we also have our guy lesbians, our punk lesbians, our beachy lesbians. There's just layers to lesbians. The custom for her as a lesbian is to be outdoorsy. She loves to go fish, and there are days where she loves to lay back at home and watch the game as well. She has been stereotyped in high school when it came to how she dressed. She dressed with basic t-shirts and pants and would get called gay. Some positive, also known as humorous stereotypes that are comparable within the website article I based my project off of and with what my sister-in-law also analyzes were driving a Subaru. Obviously, it's not just lesbians who drive this car. That's what makes it a stereotype, she said. But it's also a funny and positive one because, as she said, she does love driving her Subaru. Hence, she drives a Subaru. She also said that women being very affectionate with one another is a positive stereotype. Sometimes that's not the case with every couple because, again, that's simply another positive stereotype. U-Haul lesbians is a funny one. And she mentioned that it's a positive stereotype because this concept of lesbians moving in really fast with another lesbian isn't always the case with couples, but when it does happen, it usually is the best relationship that there is. She agreed that the negative stereotypes that are put forth towards lesbians are the following, such as lesbians hate men. She said that's definitely not true. Another negative stereotype is that in every lesbian couple, one has to be the man, and that's completely not true, she said. One person within the relationship doesn't have to be masculine and the other feminine. Both women within the relationship can be completely feminine. Luckily, she's never ran into complications at the hospital or with any of the doctors she sees for her health. She said that she doesn't wear her sexual orientation, meaning she does not act very masculine. And when she gets asked a question about her orientation or about her partner, the doctors suspect her. She said that location really does matter when it comes to healthcare for her culture because she lives in a non-conservative city with many other individuals who follow her culture. It is a more safe within the city she lives in, which is Los Angeles. They're less judgy towards her, very informative doctors as well. She is less shamed, and she believes that because of her location, this is why she does not feel any sort of judgment towards her when she goes into healthcare settings. In my own opinion, within the entire America, every healthcare professional should respect any being that comes forth through their door. Whether the lesbian patient is in a healthcare setting in Alaska or Texas or Alabama, wherever it may be, they should feel comfortable. The patient should feel comfortable, just like some Californians feel comfortable to go into the hospital settings. Then everyone in every city in America should feel comfortable. To be a valid healthcare professional within the healthcare setting, it's a healthcare professional's duty to value a patient with respect. Provide accurate education. This is the ethical way to act towards another human.